Hi, my name is Jenna Nimri, and I am the Internal Medicine Pediatric Chief Resident at Oklahoma University Health Sciences Center in Oklahoma City. You are applying at a time of great growth for OUHSC. We have recently become our own entity, and behind me you can see the new adult tower that's going to open soon. It will have about 150 beds, state-of-the-art technology to expand on our inpatient wards, ICUs, and operating rooms. We are the state's only level 1 trauma. We have the state's only level 4 neonatal ICU. We have recently expanded our pediatric ICU and working on renovating our pediatric cardiac ICU. One more thing I really like about our campus is that all the big hospitals are interconnected with a skywalk. And for us MedPeds residents, it's really nice because we have to work at many hospitals, including children's, the old and the new adult towers, the outpatient buildings, and the VA hospital.
Hi, I'm Bassem Nasser. I'm the new MedPeds intern. I want to talk about my experience here. I'm from Syria and I came from different culture with different health systems. So in the beginning I was scared to start my residency. But with the whole help and support that I get from my upper level and my attending, I feel more comfortable right now. I always feel there is somebody here to help. Whenever I have question or I need help, I just find somebody around me and they will help directly.
Hi, my name is Lauren Roten. I'm an intern here in the Internal Medicine Pediatrics Residency at the University of Oklahoma. I am a brand new mom to a 4-month-old baby girl and an intern. It was a scary time to be starting my intern year, but the program did a great job of supporting me. I was able to start in an outpatient rotation that let me get off a little bit early and had weekends off and was still very supportive. And they always made sure they're, asking me, hey, have you had time to go and pump? Or, how is your little girl doing? I felt like I could grow both as a mother and an intern all in the same year.
Hi there, I'm Fatima Sakir. I'm one of the recent graduates from our combined Internal Medicine Pediatrics Residency Program, and I have recently joined the faculty here in the pediatric clinic. So I wanted to introduce you guys a little to our clinic system. So as a MedPeds resident, you will be rotating through both the internal medicine clinic as well as the pediatric clinic.
Hi, my name is Ben Upton. I'm a second-year MedPeds resident here at OU. So this is an example of our internal medicine resident rooms. This is where we see our patients, our continuity patients. As you can see, it's set up just like any typical clinic room would be, as you would expect.
It's basically a half day every Tuesday. One Tuesday you'll be in medicine, the next week you'll be in peds, and you just kind of rotate vice versa.
Like Fatima was saying, we alternate our clinic weeks between medicine and pediatrics. I think the strength of this system is that it ensures we see a similar number of medicine patients as well as our pediatric patients, instead of leaning one way or the other with all medicine or all pediatric patients on our panel.
Hi, I'm Steve Travis. I'm the director for the OU Health Sciences Internal Medicine Pediatrics Residency Program. I wanted to tell you a little bit of something about our inpatient internal medicine rotations. Essentially, here at OU Medical Center, we have 4 teams inpatient, and on those teams you will typically have your attending, an upper level resident, two interns, and anywhere from 3 to 4 medical students. Basil mentioned about autonomy. I think one of the good things about the MedPeds program here at OU Medical Center is that we essentially give our residents the amount of autonomy that we feel that they're ready for. So as residents progress, you will find that you'll have more and more autonomy, but we never want to put you in a position where you feel like you're in over your head, and we absolutely never want to put you in a position where you don't feel like you have adequate support.
Hello, my name's Amanda Moyer, and I'm a graduate at the MedPeds Residency at the University of Oklahoma. I'm currently serving as an internal medicine chief resident, and I have plans to complete a dual fellowship in both adult and pediatric rheumatology.
Hi guys, my name's Blair Kirkpatrick. I'm one of the second year GI fellows here at University of Oklahoma Health Sciences Center. I graduated from internal medicine and pediatrics combined residency just over a year ago, and I'm now certified internist and pediatrician.
I received excellent training at the University of Oklahoma. I think one of the strongest aspects about the MedPeds program in OU is the quality of training that you get on both pediatric and internal medicine.
So a lot of people do ask me that I am now doing just pediatrics and not internal medicine, and if I feel like maybe I shouldn't have chosen a combined program and just done pediatrics. My answer is always, I do not regret at all the decision I made, and if I had to make it again, I would do it again in a heartbeat. Reason being, you get such good exposure to a wide variety of diseases and age ranges that you feel comfortable with pretty much anything that you see.
Leaving a combined residency to be feeling so confident in the level of care that you can provide to both pediatrics and adult medicine is really something I take a lot of pride in.
And on both sides, we have numerous specialists, so you're going to get exposure to pediatric cardiology, congenital heart disease, adult cardiology, and same with rheumatology, pulmonology. You're going to have access to all that and learn from them.
It's certainly a different approach whenever you're treating an adult versus a child, and to bring that skill to the adult population, I will always look back and be very appreciative for that.
Hi, my name is Anthony Sheldon. I'm one of the second year MedPeds residents here at OU Health Sciences Center. All right, so one of the things we always get asked is what's the living situation like here in Oklahoma City? And, you know, we kind of break the areas down into a few locations where most of the residents and physicians live at. And the most northern area a lot of people live, and a lot of our attendings is in the admin area. And then you have an area called Midwest City, kind of to the east of the Health Science Center, which is another good kind of suburban area that a lot of people will choose to live. But depending on either one where you live, honestly, it's pretty close to the Health Science Center. Some people will ask what the drive is like, and it takes me about 15-20 minutes to get to work, because the question they get asked is how is rent and budget like. And whenever I came here, I would say that if you live in one of the apartments, the prices can range about $600 to $800, or for a 2-bedroom apartment with a 2-car garage prior where I lived out here in Moore across the interstate, about $1,400, which is exactly how much it cost me to afford this house here. So I think it's very affordable on the resident salary, and you mix that with the cost of living, it was a very good experience for me.
I'm Daniel Roten, born and raised in Stillwater, Oklahoma. I received my medical training here at the University of Oklahoma, and now I have the privilege of serving as one of the chief residents for the Internal Medicine Residency Program.
Hi, I'm Gia Sheikh. I'm one of the first-year pulmonary critical care fellows, and I was a recent graduate of the Medicine Pediatrics Program myself.
So we just became new parents. We have a lovely 4-month-old at home right now. I guess she's at daycare, isn't she?
Mm-hmm.
And we just wanted to give a little blurb on how wonderful the residency program has been on supporting us as parents and new physicians.
Well, nothing can truly prepare you for becoming a parent. It's a unique experience that nothing really compares to. However, the program leadership has done a phenomenal job of providing both of us with emotional support during this enormous transition.
Yeah, and it's not just us, multiple other residents have had families. Some started with kids, some had kids in the middle, and so it's an understanding that people do have a life outside of residency.
A great city, a great place for us to raise a family, to raise kids in this area.
Oklahoma City is a wonderful and exciting place for young professionals like us to be starting a family in. It's really a unique place to live because it provides all of the conveniences of a very large city, but it also has that small town atmosphere that is so inviting and nice to live in.
So the reason that I chose OU is when I came here on interview day, I was blown away by how friendly everybody was, how supportive everyone was. All the residents really got along really well. That was something that was really important to me when I was searching for residency programs.
Such amazing, loving people here. We have great patient population. I myself feel so welcomed all the time. This is my second home. I love being here, and I really hope you guys can join us too.
I would invite you to strongly consider the OUHSC Internal Medicine Pediatrics Residency Program. Thank you.
Good job.